Dry skin is usually caused by a number of different factors, particularly as you get older, your skin becomes much drier, but also we often clean our skin probably too many times. We have showers in the morning, have showers after we finish work, in the evening, and that certainly takes off the natural oils of our skin. Also the environment that we live in. We live in, usually particularly in the winter times, we keep the heat far too high and the humidity is low in our houses. Well, when I see them as a dermatologist, often because their skin is itchy, but certainly other things. They often complain that their skin is kind of rough and scaly, feels leathery to the touch. But often the thing that makes them come to see me is because their skin is itchy. Very important to educate your patients with dry skin because it is such a ubiquitous problem. I usually tell them that they have to use moisturizers, and I usually have them pick moisturizers that don't have fragrances in them, that have actually a low number of ingredients in there. If they go to the shelf and they see a bottle that has 50 or 60 ingredients, then I say maybe one of those they may react to. So I get them to use and apply an emollient, particularly during the winter time, every time after the bath, after they have a shower, and I often tell them not to completely dry themselves, to pat themselves dry and then put the moisturizer on over top of that. In moisturizers, there have been a number of new developments recently, particularly our understanding of the barrier of the skin. When I went to a university many years ago, the skin was just a barrier. It was just like a piece of leather on top of your skin, of your body. And we now understand that a lot of the components within that epidermis. And particularly we understand that part of that is something called ceramides. And these are very useful in maintaining the barrier. And so a number of newer moisturizers are containing ceramides. And I think that's a positive step in the moisturizing market. Yeah, absolutely. People sometimes use harsh soaps, particularly if they have fragrances in them. And if they're showering and bathing far too frequently, they're going to take off that natural oil, the barrier that they have in their skin. So I usually often have people use sort of syndettes, different synthetic type of ones that are actually moisturizers within the actual cleansing solution. The connection between eczema and dry skin is sort of a matter of degree in my mind. Dry skin starts, it's dry, maybe just feeling rough to the skin, maybe a little bit itchy. If you leave that and don't treat it and use the moisturizer, it then gradates into deeper breaks in the barrier of our skin, becomes red, more itchy, inflamed, more rough, and we progress into eczema.